Hello and welcome to the 2021 Liverpool Hospital Palliative Care Memorial Service as part of the South Western Sydney Local Health District. As healthcare staff and clinicians, we acknowledge and remember the palliative care patients, their families and carers as part of Liverpool, Braeside, Camden, Campbelltown, Bankstown and Bowral Palliative Care Services. The Palliative Care Service aims to provide holistic and personalised care to patients in the face of advanced illness, support to their families and carers towards end of life, whether this occurs in hospital or in the home. As a service, we recognise the importance of patient-centred care to uphold quality of life and to promote dignity at end of life. Liverpool Hospital has been holding an annual memorial service since 2013. Usually, this service is a special time for palliative care health staff to reflect on the privilege that comes with providing this specialised care and to reconnect with families and carers in remembering their loved ones and grieving the loss of those who have died. For many, 2020 brought a lot of change as we felt the first waves of the COVID-19 pandemic ripple through our community. The pandemic also brought new challenges for healthcare staff, however, made it especially hard for patients, their families, friends and carers, as it changed the familiar ways of caring and supporting those we care about when they're in hospital. The COVID-19 pandemic in 2021 has brought more challenges than ever, and everyone has been touched by different losses through illness, the lockdown and restrictions. But this brought particular heartache, especially for those needing care in hospital, and for you, as the families and carers and friends. Despite this, we look for safe and new ways to care for each other, to support our families, friends, and to connect with our multicultural community, which is more important now than ever. We hope this memorial today provides a space to reflect, grieve, share stories for those who have died, however, to also connect with each other through this loss. Before we start, if you'd like to prepare a comfortable and quiet space. Also, if you have a picture of your loved one and can find a candle that you can light with us later in uniting and remembering your loved ones. Thank you for sharing your time today and for joining us in remembering.
My name is Cheryl Pedras. I'm a proud Wiradjuri woman working on direct land as the Aboriginal health worker with the South Western Sydney Local Health District's Palliative Care Service. It is my honour to be presenting acknowledgement to country in recognising the continued connection First Nation people have to their land. I would like to acknowledge the Darug, Ganangara and Tharawal people upon whose ancestral lands I join you all today. I pay my respect to elders both past, present and emerging, acknowledging them as the traditional custodians in caring for country for thousands of generations. I extend my respects also to First Nation people present here today.
You are not gone while still I see your face in my thoughts and dreams, your smile to stem the tears. You are not gone while still I hear your voice in distant echoes, your laugh to calm my fears. You are not gone while still I feel your hand reaching out for mine, your presence always there. You are not gone while still I have your love to keep in my heart and family joys to share. While still I have the memory of you, you are not gone.
My name is Dr. Thang Huynh. I am the Director of the Liverpool Palliative Care Department. I wish to warmly but solemnly greet all of you who are watching our Palliative Care Memorial Service. You may be the carers of loved ones who have passed on. You may be family members. You may be dear friends. You may also be healthcare staff joining in this service to mark your respects and to honour those whom you have had the privilege of looking after. For carers and family members, I say thank you for taking the time to come together with all of us in South West Sydney Palliative Care Services. It cannot be easy to reflect and remember during such difficult times, to relive and remember the grief and sadness that comes with the passing of this special person. For those of us who have known grief and known loss, this is truly a painful and devastating emotion. For some of you and some of us, these emotions may be too great and you may not feel able to continue watching this memorial service. Of course, that is absolutely okay, and you may choose to stop viewing this service at any time. When you do feel able, certainly you can re-watch the program at any later time. For those carers and families who stay with us, I will express my heartfelt condolences for your loss. It is already so difficult, but made even more so by the current circumstances. The COVID pandemic has been with us for 18 months and more now, and it has completely reshaped the way that families, friends and communities come together. Most of these changes have unfortunately been for the worse. No longer do we have the carefree joining of and meeting of close and distant families, of new friendships forming and old ones rekindling, of making celebrations for life's major events and the commemoration of life's somber moments. We have been artificially held in lockdown and sometimes held in isolation, which is both uncomfortable and unwanted. But we know this has been for the greater good for us as individuals, for us as families, for us as local communities, and for the entire us of our nation. For that we should acknowledge and congratulate the efforts of us all. Yet sadly, some of the greatest sacrifices we have had to endure is not being able to come together as families and friends to support each other during times of sickness and sorrow. Nowhere has this been more keenly felt than in those very sick individuals who have spent their last few days and few weeks with illness. For those needing hospital admission, it has been excruciatingly difficult not to have the physical presence of their carers and family by their side, particularly when they are navigating their final steps. And while COVID does not discriminate who it affects, the repercussions of this pandemic are widely felt by everyone. I also wish to acknowledge all of our healthcare staff over this time who have provided amazing service to their patients, sometimes under the most trying of circumstances. Our doctors, nurses and allied health teams have not been able to welcome all manner of visitors, friends and families onto our wards, as we would normally do. And this has caused great discomfort and distress amongst ourselves, because we are all trained and all focused on the best quality of care for our patients. Finally, I wish to reflect on the faces, the stories, the interactions and the spirits of those dear people who have now left us. I would call them my patients, and even as I have worked to help them, they have themselves taught me so much about life. But you would all call them your beloved mother, father, sister, brother, wife or husband, grandparent, son or daughter even. Or perhaps call them a dear, dear friend. And because you know them so well, then please reflect and remember not just the darkness, but also all of the joyous moments, the great accomplishments of their lives, and the amazing love they have given you. Thank you.
الرحلة سوف تبتدي. لا تفكر أنهم رحلوا. فكر أن الحياة تحمل لنا حقائق كثيرة، والأرض واحدة من هذه الحقائق. فكر أنهم يرتاحون الآن من الألم والدموع في مكان هادي ومريح، مكان ليس فيه أيام أو سنين. فكر كيف يتمنون الآن أن نعرف اليوم أن لا شيئا بل أحزاننا لابد أن تموت اليوم. فكر فيهم أن هم أحياء في كل قلب اتعاملوا معاه أو لمسوه، لأنه ليس شيئا في قلب نحبه نفتقده، ونحن قد أحببناهم كثيرا.
As the year comes to a close, we'll be reflecting what a tumultuous year this has been. I would like to acknowledge and recognise how much the COVID-19 pandemic has affected death, dying and grieving. I'm sorry for the additional struggles this has presented, and in particular for those of you whose loved ones died in hospital and the restrictions that were in place. I'm sorry that many of you have missed out on having your whole family together during this important time. I cannot begin to imagine how difficult this was for you. I would like to thank you for allowing us into your lives and allowing us to take part in the care of your loved ones at a time that is so very personal and precious. It has been and will continue to be a privilege, and for that I will always be grateful to you and humbled by the trust you put in us. I'm always in awe of the way families and friends care for someone they love in their living and in their dying. You are amazing. I would like to thank you for not only allowing us to be part of your lives, but for teaching us and teaching me so much. From you and your loved ones, I continue to learn about love, patience, commitment and immense bravery. I hope today provides you with some comfort and helps with the pain, sadness and loss you have suffered. Today I would like to honour and remember your mother, your father, your son, your daughter, your brother, your sister, your relative or beloved friend. I would also like to honour and pay my respects to you, their carers. Please take care of yourselves and those you love. Thank you.
Có sự linh thiêng trong những giọt nước mắt. Nước mắt không phải là dấu hiệu của sự yếu đuối mà là sức mạnh. Nước mắt là những lời hùng biện hơn cả vạn lời nói. Nước mắt thay cho nỗi đau buồn ngập tràn, niềm hối tiếc sâu xa và của tình thương yêu không nói nên lời.
My name is Wingecarribee. My mother, Irene Scortis, was admitted to 4C, the palliative care ward of Liverpool Hospital in the beginning of October 2020. By this stage, Mum had fought breast cancer for 24 years and she was also in the later stages of dementia, and her mobility was also quite restricted. Because of Mum's dementia, she didn't always know where she was or recognise people, and she could become quite distressed. Because of Mum's confusion and her rapidly deteriorating health, my brother and I decided that one of us would be with her in the hospital day and night, and we would care for her ourselves as much as possible. The staff at 4C were so supportive and understanding of our need and did everything possible to facilitate this, even by providing us with our pull-out bed for us to use and by helping us care for Mum. The palliative care ward is such a special place, and the staff, whether it's the doctors, the nurses, the social workers, the clerical staff or the cleaners, are such amazingly special caring people. Personally, they made this difficult time easier by providing me with support, someone to talk to and a shoulder to cry on when I needed it. I recall Mum's doctor telling me she and all the staff of 4C feel so honoured to be involved in this stage of a person's life. This genuine expression is evident in the way they treat this end of life stage for their patients and their families, with respect, care and understanding, always with a kind word and a sense of humour. You'd think that a palliative care ward would have a gloomy and sad atmosphere, but anyone who's visited 4C will know the opposite is true. It has a warmth and a vibrancy about it. I think this reflects the people who work there. Mum passed away on the 31st of October 2020. It was an incredibly heartbreaking experience to lose our wonderful Mum. We cannot thank the entire staff of 4C enough for all the love, care and support they gave Mum and us during her end of life journey. Thank you.
Today I light this candle in remembrance of the patients and their families who were cared for by the Hoxton Park community and Liverpool Hospital Palliative Care Service. This candle is to signify your loss and the light that they leave in this world forever. They will be forever loved, never forgotten and always missed.
I light this candle today in memory of those that have died and are no longer with us from the Wingecarribee Shire in the beautiful Southern Highlands. I also acknowledge those that provided their care, love and support both in an informal and formal capacity.
The community team light this candle in memory of the clients and carers the Bankstown Palliative Care inpatient and community team have cared for and supported for their end-of-life care.
I light this candle on behalf of the Macarthur Palliative Care Service to acknowledge the grief, courage and memories of our patients' loved ones. The lives of the ones we love live on in the memories of the living. Death ends a life, not a relationship.
I light this candle in remembrance and recognition of the patients, families and carers of Braeside Hospital and Fairfield Palliative Care Services. This light shines as a symbol of life remembered, eternal shared memories and love that will stay in our hearts forever.
I'd like the memory of me to be a happy one. I'd like to leave an afterglow of smiles when life is done. I'd like to leave an echo whispering softly down the ways of happy times and laughing times and bright and sunny days. I'd like the tears of those who grieve to dry before the sun of happy memories that I leave when life is done.
Today we've heard and shared memories of those who have lost. Sometimes this grief can bring times of darkness where we feel alone and overwhelming loss, missing the strong bonds and the relationships of those who have died. But it is in that darkness there is light, sometimes like flickers and wavers as grief comes, remembering anniversaries or shared times together. But it is in this light of hope that brings us together through this loss. Perhaps talking or spending time with a supportive family member or friend today, remembering your loved one. If you would like further support, please see these contact details for ongoing grief and bereavement needs. Thank you for joining us today and sharing in these memories.